Hello. I trust you are doing great today. I am Dr. Fernand. I'd like to enlighten you about benign prostate hyperplasia, BPH, just by telling you a patient's experience. Mr. Ken Johnson have been married to Mrs. Rebecca Johnson for over 25 years now. The couple are blessed with 2 children, a boy first, and then a girl. They both are now in the university. Mr. Ken Johnson have been noticing a systemic change in his body quite for some time now. He experiences abnormal discomfort in urination. Early one morning, Mrs. Rebecca Johnson woke up to the sound of the toilet's door as Mr. Ken Johnson closed the door with a long sigh and a worried countenance. This indicates that all was not well with him. Intuitively, Mrs. Rebecca immediately understood that her husband just experienced a more intense discomfort in urination, and that the herbal concoction her husband had been taking tenaciously for over a week was not helping in any way. Mrs. Rebecca stood up and walked straight beside the cupboard, brought out the herbal concoction, and dumped it into the waste bin, saying to her husband, "My dear, we will go see the doctor first thing tomorrow morning." As she could no longer watch her husband suffer more pain, Mrs. Rebecca noticed that her husband was murmuring, but she already knew why. Mr. Ken hated the scent of the hospital, and now his wife, Mrs. Rebecca, was talking about taking him down there. 8 a.m. on the dot, Mrs. Rebecca and her husband, Mr. Ken, were at the city hospital, and they were directed to the urology section. They waited briefly before seeing the urologist, as medical consultation starts by 9 a.m. At exactly 8:30 a.m., the doctor walked in, and by 9 a.m., the couple were called into the doctor's office. After a series of medical investigations, Mr. Ken was diagnosed with benign prostate hyperplasia, BPH. Now, I know you must be wondering what this is. Just a little bit of your time, and I will explain. Benign prostate hyperplasia is a non-cancerous enlargement of the prostate. Please know this: the prostate is a part of the male reproductive organ, located at the outlet of the male bladder. The main people who are at risk of BPH are men that are aged and men above the age of 50. Symptoms that indicates the presence of benign prostate hyperplasia includes 1. Obstruction of the urine, hence increases internal urine pressure. 2. Reduced flow of urine. 3. Nocturia, regular need to arise during the night in order to urinate. 4. Acute urine retention, regular feeling that the bladder was not fully emptied after urination. 5. Sudden urgency to urinate. 6. Frequency of urination. 7. Hesitancy of urination. 8. Dribbling of urine, and sometimes there can be blood in the urine. This illness is usually diagnosed by running the following tests: 1. Digital rectal examination. Every male above 50 years should run this test yearly. 2. Urinalysis, urine sample lab examination. 3. Uroflow less than 10 ml suggests obstruction. 4. PSA prostate-specific antigen. 5. Transrectal ultrasound. Treatment. This illness can be medically managed at best. It is expedient that you notify your doctor once you notice any of these symptoms, or kindly report to the hospital for proper diagnosis and treatment. Please do not practice self-medication to avoid complications.